vascular assessment of the lower extremity. So first I'm looking for trophic changes down their leg and down their feet, and I'm going to also assess temperature of their skin. And down by their ankles I'm going to check for skin thickening, and then I'm going to check for capillary refill. So I'm going to depress the toenail and I'm going to release, looking for blood to return, and that should return within a couple seconds. I'll come to the opposite side, depress the toenail, that should come back within a couple seconds. Next I'm going to check for edema. So I want to check in the top of the foot. I'm going to press down on the top of their feet, see if there's any pitting edema. I'm going to press down behind their ankle on the medial side, look for any edema, and depress on their shins, looking for any edema. And I would want to also depress anywhere else if I would suspect some pitting edema. And then I'm going to check for pulses. So I'm going to first check the dorsalis pedis. So I'm going to find that pulse in the, just lateral to the great toe extensor tendon. I'm going to come to the opposite side too and compare. And then I'm going to check for the post-tibia pulse, and that's on the just behind the medial malleolus on the medial ankle. And I'm going to compare both sides. Next I'm going to check the popliteal pulse. So on the patient flex their knee, I'm going to check in the popliteal fossa, and I also want to compare both sides. And then I'm going to check the femoral pulse, so that'll be found between the ASIS and the pubic bone. So I want to instruct the patient that I'll be palpating here. So I find that pulse, I want to compare both sides, and then I'm going to come just medial to that. I'm going to feel for an inguinal, feel if there's a presence of an inguinal hernia, and then I want to check for lymph nodes. So I'm going to check the horizontal lymph nodes first, and then the vertical lymph nodes down the medial thigh. Check the horizontal lymph nodes on the opposite side, and vertical lymph nodes down the medial thigh. And then I'm going to listen with the bell of my stethoscope for a femoral bruit, and I should not hear one. And I would do that on both sides, so we do not want to hear a bruit. And then I'm going to do Homan signs. So I'm going to have the patient flex their knee, dorsiflex their foot, and I'm going to squeeze their calf. And reproduction of pain could be a sign that they have thrombophlebitis. And if I suspect it on the opposite side, I would do the same thing. Have the patient flex their knee and then dorsiflex their foot. I'll squeeze their calf. Presence of pain would be positive indicator that they could possibly have thrombophlebitis. Next, I'm going to do a straight leg test. So I'm going to, or an elevated leg test. I'm going to bring their legs up, and I'm going to have them kick their feet back and forth and help get the blood out of their feet and legs. And once it looks pale or dusky, I'm going to bring their legs down to the ground, and I'm going to instruct them to sit up, and blood should return within a second or two. And just checking for sufficient arterial blood flow. And then I want to check for valve problems in the veins. So I would have the patient standing for this test. I'm going to palpate the medial thigh, and then I'm going to tap on the medial knee on the saphenous vein, and I shouldn't feel anything on this superior hand. And if I do feel that there's tapping, then I would suspect some sort of valve insufficiency, and I'll do the same thing on the opposite side.